My name is Tracy Sharon, and I'm the CEO here at the Saskatchewan Health Quality Council. Before we get started, I just wanted to be sure everyone is aware that our session is recorded, and the recording has started, and the recording will be available to anyone on the HQC website following the session. And so please feel free if you'd like to revisit some of the material to access the recording yourself and to pass it on to your friends and colleagues. And you can also check out any other sessions you may have missed in the past. So we're so excited that you've joined us today here at QI Power Hour. For those of you who may never have attended before, QI Power Hour is a free monthly webinar learning series hosted by the Health Quality Council here in Saskatchewan. And we bring together improvers from a variety of sectors with an interest in improving health and to learn about quality improvement related topics. Sorry, I'm having trouble finding the tiny little advance button on my screen, but I think I'm getting better at it. As we get going, I want to share that I am joining you here from HQC's main office in Saskatoon, located on Treaty 6 territory, the traditional lands of the Dakota, Lakota, and Nakota, and the homeland of the Métis. And here at the Health Quality Council, we serve the entire province, which also includes traditional lands included in Treaties 2, 4, 5, 8, and 10. And we as an organization pay our respects to the treaties that were made on this land and acknowledge the harms and mistakes, not only of the past, but those that continue today. We are committed to moving forward in partnership with Indigenous nations in the spirit of reconciliation and collaboration. And I can say too that my ancestors came to Canada from Europe in the late 1800s and early 1900s, and that they settled this land and were afforded, certain privileges that came with that. And I also know that that came at a cost and came at a price to many people, and those impacts continue today. And I personally commit to moving forward in a good way in the spirit of reconciliation. So as I said before, we are recording today's session. It will be available on the website following the event. And of course, you can check out recordings of previous sessions as well. While you're on the website, I'd also invite you to sign up to our QI Power Hour email newsletter, and that will ensure that you get regular invitations to future sessions and know exactly what's coming up. Over the last few years, we have been so excited to see the continued growth of this QI Power Hour session throughout our home province of Saskatchewan. And so on the screen, you can see many of the different organizations that have joined us over the years. And here are some more. We've also had several folks and organizations join us from across Canada. And around the world. So we want to thank you all for spending your time with us and for your commitment to ongoing learning to improve the systems you are each a part of. Just a few things if you're not familiar with the WebEx tools that we have available to us during the session, and we're very much looking forward to your engagement and participation today. We encourage you to share your questions and insights during today's session by making use of the chat function. And you can access that function by clicking on the message bubble towards the bottom of your screen. This will launch the chat panel. It's on the right-hand side of your screen. And we encourage you to share your questions, comments, and ideas throughout the entire presentation. We will have some time dedicated to questions and answers at the end, and I'll moderate that for you. So I'll be monitoring the chat throughout. So please send your questions to all participants so that you have the option to select all participants so that we can all see your great questions and insights. And so let's just take a moment here just to practice, make sure we all are familiar with how to use that function. If you could enter the chat function and type in the name and location of where you're joining us today from, and if you happen to know what treaty territory or other territory in Canada you might be on, please share that as well. I'm not seeing too many come through yet. Oh, here we go. So just want to be sure everybody knows how to use the chat function. I'm seeing a few messages come through. That's great. Welcome to those joining us from Treaty 6 in La Ronge. There we go, excellent. All right, so we've got that chat going. So with that, I am so pleased to introduce the speakers for our session today. So first I'll start with Dr. Gary Groot. Dr. Gary Groot is a surgical oncologist and professor in the College of Medicine at the University of Saskatchewan. And he has a passion for health system improvement, cancer research, and Indigenous health research. And we're very happy to have him joining us today. And also joining us is Patrick Fallisen, who's a program director here at Health Quality Council, where he leads measurement, reporting, and evaluation initiatives to advance health and healthcare improvement. And why I'm really excited about this topic today is it gives us a chance to hear about the role that continuous, rapidly available evidence about what works, what doesn't, and why can accelerate improvement in health and healthcare, and the role that partnerships like this one between the Health Quality Council and the Saskatchewan Health Authority can play in advancing that work. So without further ado, I will pass it on to Patrick and Dr. Groot.
Thank you very much, Tracy. And good morning, everyone. As Tracy mentioned, I'm Patrick Fallisen. I'm a director here at the Health Quality Council, and I'm pleased to be presenting some work we've been doing during the vaccination rollout with Dr. Gary Groot. A bit of an overview of this session. I'll take a few minutes, hopefully not too long, to introduce developmental evaluation so we all know what it is, how it aligns with quality improvement approaches, and how it can be helpful. Then I'll turn things over to Dr. Groot to talk about how we applied developmental evaluation during the COVID-19 vaccination rollout in Saskatchewan and what we learned from that process. I'll start off with a couple definitions just because it's always good to start with the most confusing thing, but then we'll move into a little more breakdown of what it is. So these definitions come from an evaluator named Michael Quinn Patton. He's one of the founders of this idea of developmental evaluation. Some of his concepts here are about evaluative processes, including asking questions, applying logic, challenging that logic to support program, product, staff, and organizational development. The evaluator in developmental evaluation is usually a part of a team working to conceptualize, design, and test new approaches in long-term ongoing processes of continuous improvement, adaptation, and intentional change. The evaluator's primary function on the team is to pull out some of those evaluative questions, to present data, to present some logic, and to facilitate database decision making in the process of developing an intervention. And that'll become more clear by the end. I'll pause briefly here to familiarize us with Pdsa cycles. So the image you see is what's called the System of Profound Knowledge. It's from the Institute for Healthcare Improvement. When you work at HQC, you get this tattooed on your back. It's kind of foundational to quality improvement. It describes a process of identifying a target and using cycles of plan, do, study, act to achieve your goal and to measure it. In practice, and typically this is what you see is converging circles of Pdsa where you make some change, learn from it, and then apply that learning to the next change, from one improvement cycle to the next. And then when what you can do is think about developmental evaluation as a cycle that encompasses it all, where the journey is followed, and developmental evaluation is supporting these Pdsa cycles with information, observation, evidence, and feedback. So I'll go a little further into distinguishing developmental evaluation from traditional evaluation. I think when most of us think about evaluation, we think about you have a status quo, you change something, you change a program, you add a program, you change resources, and then you measure that change, the impact of that change against your status quo. And that is typically what you would call a summative evaluation. And some instances are formative. These are generally used in accountability type things. If we're going to invest in a change, we want to know that that change leads to an improvement, and that improvement is value added. In developmental evaluation, you're supporting the innovation and adaptation in dynamic environments. And as I go through these kind of definition things, I want you to think about the vaccine rollout and how it had to happen, where it was a new process, not a new circumstance, I would say, maybe not a new process. So roles and relationships in traditional evaluation, ideally you want the evaluator as an outsider, an independent, objective person who can look at things, look at some data, and make a decision. Complete opposite, developmental evaluation, you want that person to be as close to the internal team as possible, because they can help gather data and interpret it, use that team context for that data interpretation. They can frame issues, they can surface issues, and test models of doing of intervention. Traditional evaluation, your accountabilities typically lie to a funder or to an external. We got to improve our program, improve our throughput, our impact, our outcome, whatever it may be. In developmental evaluation, you're accountable to the team, to the innovators, the people who are working on the intervention. So this isn't about building a report card that goes, gets reported up. This is about improvement and how we provide information to those teams who are working in Pdsa cycles to make a difference. Traditional evaluation, you look to control options. You look to make a decision. That's kind of the research approach. We're going to test what we did, option B against option A as status quo. Developmental evaluation, again, you're focused on utilization and how that information can be used to apply to the next thing. Measurement, traditional evaluation, you're measuring your outcomes and against your intended change. So we thought we'd see a reduction in wait times by 10%, and you measure that wait time and you see if you achieved it or not. In developmental evaluation, you're tracking mechanisms. What are we building as outcomes emerge? Measures can change during the evaluation. Some measures could be useful at parts of an intervention, and then they become less useful as that intervention moves on. So you move on from that measure. Results in traditional evaluation usually end up in a report, a PowerPoint presentation to a decision maker, and sometimes on a shelf somewhere. In developmental evaluation, you use those results in real time. You're working as quickly as you can to provide feedback to those teams. You try to use diverse, user-friendly forms of feedback, things that are digestible by the team. And the whole point of this, the results of this, are to nurture learning, not to force accountability. Complexity, I think traditional evaluation can be more or less complex depending on how rigorous you put into it. You can control for age and sex and standardize this and that. In developmental, you're learning to respond to a lack of control. You're not able to control the situation. They're typically very dynamic and changing quickly, as we saw in the vaccination rollout. You're staying in touch with what's unfolding and responding accordingly. And then the standards you would look at, in developmental evaluation, it's all about flexibility, adapting to the situations that come up. Systems thinking, creativity is a part of this, about what we're seeing and how that can be learned, or how the learnings can be applied either more broadly or in different contexts. So there's a high level of ambiguity there, and it requires a team, and it requires openness and agility in being able to deliver. So I know that was a crash course, and I know people are really here to see Dr. Groot and not myself, but I will try to explain a bit of complexity. So now that we have a bit of what developmental evaluation is, and there'll be resources if anybody wants them, I can share them. But let's talk now about when to use it. So I'm using what's called the Zimmerman-Stacy matrix to help explain that. I won't bore you about what it is, but it's a theoretical construct to help understand complexity. I'll start explaining this from the horizontal axis, the x-axis, where it says certainty. So issues or decisions that are close to certain, that's when you have cause and effect linkages that can be determined. This is usually the case when there's a very similar issue or decision that's been made in the past. One can extrapolate from past experience to predict the outcome with a good degree of certainty. So if we open more beds, we will, if we ramp up surgery, we'll reduce the wait list, cause and effect. Conversely, if you're far from certainty at the other end, decisions, these situations are often unique, or at least unique to that context or those decision makers. So the cause and effect linkages aren't clear. Extrapolating from past experience isn't a good method to predict the outcomes with any degree of certainty. And on the y-axis or the vertical axis, we have agreement. So this axis measures the level of agreement about an issue or a decision within a group, team, or a system. So as you would expect, leadership function varies depending on the levels of agreement surrounding an issue. So this is everybody's comfort zone, where you're close to certainty and close to agreement. In this region, you use techniques to gather data from the past, use those to predict the future. You can plan specific paths of action to achieve outcomes and monitor the actual behavior by comparing it against your plan. This is, the textbook process for management. It's issues and decisions fall in this place. It's really easy. You make a plan, you execute your plan. The goal is to repeat what worked in the past to improve efficiency and effectiveness in the future. Now let's look at those items that have a good degree of certainty, but high levels of disagreement about which outcomes are desirable. So in this instance, I would call these socially complex issues, or, small p political decision making. Neither the plan nor a shared mission are likely to work in this context. Instead, politics, relationship building, coalitions, negotiations, and compromise are used to create the organization's agenda and agreement. So when you have that, that's that social complexity, and you work to build rapport, negotiate, trade off to bring that level of agreement, down towards close to. Conversely, some issues have a high level of agreement, but not much certainty as to the cause and effect linkages to create the outcome. These are what I would call technically complex decisions because they're far from certain, and there's a good degree of judgment in the decisions. In these cases, monitoring against a preset plan won't work. A strong sense of shared mission or vision can substitute for these plans. Comparisons are made not against a Gantt chart and a plan, but against the target of the organization. In this region, the goal is to head towards the agreed upon future state, even though the specific path can't be predetermined. And here, outside of those things where you're far from agreement and far from certainty is what Zimmerman and Stacy called the zone of complexity. In the zone of complexity, traditional kind of management approaches aren't very effective. But in this zone, creativity, innovation, and breaking with the past to create new modes of operation happen. Typically, we like to work in the spaces where we have both certainty and agreement, and we know how to manage the social and the complex or the technical complexities. because you can extrapolate from past experience. In, you know, the hallmark of the zone of complexity is you don't have a frame of reference. So when you move into that zone of complexity, you need a different set of tools. And it's in this space where developmental evaluation can help create clarity, learning, and innovation. So when do we use it? This is, the next two slides are kind of my visuals to kind of show us the thinking. Typical, you know, when you think project planning, you have a plan, you have a goal. Your plan requires inputs, whether that's human resources. They do stuff, they create an output. If you measured there, that would be called a formative evaluation. Did we produce the output? If you continue on to measure, did that output have the desired outcome? That's what you would call a summative evaluation. And you move up that staircase according to plan. This is where, you know, traditional evaluation, this is kind of what it looks like. But sometimes you have situations that look like this. You have a plan for which you obtained resources, but as soon as you begin to implement it, the activities change and the outputs change too. Some lead to outcomes and others don't, and outcomes can emerge in the most unexpected places. So in these types of situations, it's best to use a developmental evaluation approach, or that would be the appropriate way, because as you're producing outputs or outcomes in various spots, you want to learn from them and feed them back into the process, into the team. So the quick summary here of developmental evaluation. So it's an approach that can assist innovators develop change initiatives in complex or uncertain environments. Developmental evaluators, the originators of this kind of liken their approach to a research and development kind of process in the private sector. Where product development, because it facilitates real-time or close to real-time feedback to the program staff, thus facilitating that continuous improvement, that PDSA loop. Michael Quinn Patton is careful to describe this approach as a choice that is responsive to context. The approach is not intended as the solution in every situation. Developmental evaluation is particularly situated to innovation, radical program redesign, complex issues, and crisis situations is where these come into place. And in these situations, developmental evaluation can help by framing concepts, quick tests of change, and tracking developments while surfacing issues. So I kind of flew through that relatively quickly, but I think Dr. Groot, I'll pass it on to him and he'll talk to how we applied developmental evaluation to the vaccination rollout.
Thanks, Patrick. I'm going to more chat than anything else for the next little while, and I hope to leave enough time that we can have some questions and answers. I'm going to tell you about how our developmental evaluation of the vaccine rollout came about and how we did it. And one might argue that it doesn't look like some other developmental evaluations that we examined as we were getting set to do this, but it's our version of developmental evaluation, and I'd like to think that it worked for us. The way this all came about is that I was asked by my co-lead in clinical excellence and portfolio in SHA, Colin Hartness, if our team could do some work looking at supporting the vaccine rollout as it was getting set to go. This is, as Patrick alluded to, the vaccine rollout was an incredibly complex process with multiple players who'd never done anything quite like this before. But there was a pretty clear direction that they needed to go. There was a point B on the map, if you will. And so I I brought together, I said, let me see what we can do. And I brought together, I called Patrick almost right away and I said, what do you think? Is this something you're willing to do? Because I have to be honest, I don't think Patrick had done a developmental evaluation, and I certainly had not. I'd done different kinds of evaluations. And my focus up till now had been really largely on something called a realist evaluation. I'm going to talk slightly about that in a moment. And I called on the team that we had worked with in the SHA and clinical excellence, and there's quite a large team. Most of this work was done by my research team, Patrick, and then the team in clinical excellence, who did a lot of on the ground work as well. We created a small group of us that would meet on a weekly basis to discuss what was going on. And then we connected via Colin with the pandemic vaccine rollout leads, Tanya Dernier and Sheila Anderson. And it was interesting because when I first connected with them and offered our service, you can just imagine those two individuals. I don't know that they slept in the several months that the vaccine rollout played out. And they just initially saw us as a little bit of a fly on the wall, like get away. We don't need another person in our midst. But we met because of Colin, because Colin was on the inside, and we had a conversation, and they came to understand we weren't looking to critique them. We weren't looking to be a nuisance. We were actually looking to provide them with support as per the developmental evaluation mindset or framework. And we set up a system whereby members from clinical excellence and members from my research team would sit in on the daily huddles, the various daily huddles that the vaccine rollout team was having. And what we committed to is they would sit there as a fly on the wall and make notes about what was happening and what their observations were around the program, with the mindset that there might be things that we would see that would be value added to the team in terms of process improvement and quality improvement that they weren't seeing because they were so busy. And then we would sit as a team and discuss that and create a report for Tanya and Sheila that they could use in whatever way was useful for them. The team, by being embedded like that, they were able to see. One of the first things that they saw, I think, was that all of the people in the vaccine rollout, the people on the ground, the directors, the managers, all these people were doing an awesome job. I mean, they were adjusting well to circumstances as they came up. The detailed minutia of how they were doing their own QI work and creating improvements was working quite well. The thing that I think we added was something that comes from a realist philosophy of work, and that's the kind of evaluation that I have done mostly in the past. And that the philosophy of realism is that you're looking for not does something work. It's not a binary, it does or does not work, but to understand why it works and for whom and in what contexts. And by using that thinking, that philosophy, rather than a realist evaluation per se, which would have taken way more time and energy, we were able to see some of the underlying mechanisms of why things were working well, and I think where there were some challenges. And some of those mechanisms were at a fairly high level, and that we were able to identify those things and lift them up for Tanya and Sheila. The other thing that started happening fairly quickly is we met with them every week initially, and then every other week after a bit of time, to share with them some of our insights and for them to give us back what they were seeing as potential challenges for us to focus on as we were going forward as well. So it was a two-way process. It wasn't just us telling them what we saw, it was also them telling us what their needs were. And we, although I don't know that it was entirely fitting with a linear process. What came out of that was we melded some of the work that we've done with the evidence review team as well into this work to provide them with evidence for things when they needed them in addition. See if I can advance this the right direction. No. The right direction. So this would be an example of something we would actually create a report and that we gave to them every other week sort of thing. And it would describe what we were observing and what some recommendations that we had for improvement. And so at one point, we had a report that noticed that despite all of the work, we were falling behind as a province. We went from being top in the country for getting the vaccines out to people early on in the pandemic rollout to having top place in Canada for vaccine hesitancy. And that was something for us to be successful. We felt that there needed to be that needed to be addressed, and we needed to look at the reasons why. So we were asked, and we did do a review of the literature around vaccine hesitancy, not just from what was working and what wasn't working perspective, but trying to understand why people were hesitant using a theoretical domains framework. There was one good review that was done out of McMaster that looked at it from that perspective, and we built on that review. And that in turn led to a suggestion that we might want to beef that up with some sort of a survey that would help us understand what was going on in Saskatchewan. If the things that were in the literature fit with what was actually in the heads of people in Saskatchewan. So we conducted a very quick and dirty survey, the final results of which are just about ready to be published, but the team has already seen the preliminary results, where we asked both people who were doing the vaccinations, what were their reasons, what did they think was going on in people's minds around why they were hesitant and what it would take to get them to come and get vaccinated. And we asked the same thing of people who were being vaccinated and were having their vaccination over that 1 week period, thinking that the majority of those would be individuals that had been hesitant as they hadn't had a vaccination yet, and trying to gauge their reasons for being hesitant, as well as what they thought would bring friends of theirs that might be hesitant to come in and get vaccinated. Those things were all fed back to the team and have gone from that team to higher levels. I know from conversations with them, they then took the information that we provided to them, and it was brought to the senior leadership in the SHA and to the Ministry of Health where appropriate. And I think that kind of a back and forth, we're here to help you rather than we're here to judge you, did result in some support for the vaccine rollout, in addition to what they were already doing. So I think the impact that we had is that it did support the system. We focused on needs of the system and helping the vaccine chiefs as they did their work without actually adding to their workload, which was already quite enormous. And I think it created a different way of doing QI in this pandemic that was incredibly challenging. With that, I will leave it open to questions if there are any. We have lots of time.
Thank you so much, Dr. Groot and Patrick. And as you've just said, we have lots of time for questions. So we'd welcome folks to enter your questions into the chat, and we can make sure those get asked. Maybe while folks are thinking of some, I might start us off. And I think probably the kinds of questions that might be on people's minds are related to the developmental evaluation, and that's what we'd hope to talk about today. So I'm just curious, you talked a lot about complexity and the role of decision-making complexity and how that can be difficult and not necessarily certain. So based on your experience here, what advice do you have for decision makers who might be facing that kind of complexity and uncertainty and how to kind of wade through those pieces of evidence and maybe informed by your experience related to the vaccine rollout?
I think the one thing I'll let Patrick add his 2 cents worth as well after, but I think it is really important when you're in the middle of doing to find time, carve out time to step back from the doing to see what is happening as well. And whether that's by inviting some people to walk alongside of you and provide the kind of support we were able to in this developmental evaluation or in some other way. I think sometimes when things are as busy as they are, and especially right now, I look at this fourth wave of the pandemic, and my observations are that the people that are leading this are just about, they have no room on their plate to think. And so taking time to think and observe and sort of take a second look at what all's going on can be value added.
I think you nailed it, Dr. Groot. One of the points I think that I would emphasize or repeat from what you mentioned was when we approached senior leaders, it was not to put work on their plate, but to provide support in this complex time. So we were able, I think, to stay in touch with what's unfolding and support the system to respond accordingly, or provide some input into that response without creating extra work without detracting from what people had to do. Right? They were very focused on getting vaccines in arms, and they had to find several ways and mechanisms to do that. So I think being that feedback mechanism, staying in touch with what's unfolding and being able to provide that quickly is what helped. That zone of complexity maybe move us a little bit towards certainty or understanding of what's going on.
Great, thank you so much. We have had a question come in through the Q&A, so I'm going to read that out now. What is the difference between developmental evaluation and the more project management approach of tracking risks and documenting them and then actioning on risk mitigation strategies? Can you talk a little bit about how those two things might be different?
Yeah, I'll start, and please add, Dr. Groot. I think the traditional project management philosophy, a lot of it is based on cause and effect relationships and understanding the path, knowing what you need to do to achieve a goal. You can think, the easiest way to think of it is, building a house, like a physical infrastructure type thing. You have to prepare the ground and dig footings, and there's a sequence of events that has to happen for every house that's built. And and there's risks to that. You can consider weather, consider labor, consider costs changing. So traditional kind of project management and evaluation, when you know cause and effect and understand the path you need to go, that's where those types of tools become important. That's where traditional evaluation, did we finish on time, on scope, in budget, that kind of thing, that's where that space is. In this instance, the developmental approach, if you think back to the very beginning, vaccines were trickling into the province, and there were priority groups with folks in long-term care and so on, and then we had to build a scheduling system and figure out how do we open those up, and then drive-throughs and then pop-ups, and it was this evolving state. I don't think anyone knew on day one that we would be doing vaccinations at Pike Lake. I don't think anyone knew we'd be doing pop-up shops on day one. We didn't have that clear path. We had to build the path, uncover and build the path as the system walked on it. So there's still, some of those project management tools I think are still important. I could do a different QI Power Hour on risk management and risk thinking. It's not to dismiss that in any way. It still needs to be considered. There's risks fraught with in the pandemic rollout that I think Sheila and Tanya and the whole team really managed incredibly well. It's not an either or, but different contexts there.
I would argue that what happened in this situation, where I think we layered on a developmental evaluation on top of what was already happening in terms of project management and QI and improvement within the teams that were working on the vaccine rollout. It's not as if it was one or the other. This was such a complex project that was all happening in the background. That's the part that I said in my mind, and I think on the mind, excuse me, of the teams that were doing this, that was working pretty seamlessly. And we didn't need to interject ourselves into what they were doing well. The reality is that the vaccine rollout required a lot of work across silos within the SHA and a lot of work and collaboration between the SHA and the Ministry of Health. And so some of the things that we noticed, which were those what's in people's heads, what's going on here, sort of pieces, were communication things. Things like, the reality was, for this rollout to happen the way it did, there were people that were working 24/7. They were up late at night dealing with little details and things. And one of the things we observed was, for example, the leadership that was required and that everybody stepped up to the plate and followed around. What caused that leadership? What was behind that in the first place? It was that people were motivated, the leaders were motivated by their values and their desire to make a difference in society, despite all the work they were having to put in. And so when you started to see some of these people getting a little bit burnt out because of some of the miscommunication things, and again, I don't think they were intentional, but they were happening, just to be able to point that out, that there's a risk for you if you don't deal with those things because of the human nature of this rollout and what's causing people to want to work as hard as they are. And so those are the kind of things that we added to what was already happening in terms of the project management and the QI structures that were in place through the Health Authority, which I was very impressed with.
Great, thank you. So we've had another question come in through the Q&A, and this one's from Amir Azizian. Hello, Amir, nice to hear from you. He says, thank you very much for a very informative presentation. And his question is, in the team development phase for a developmental evaluation, how do you identify all the key stakeholders of whatever the program or innovation is that you're evaluating? And is it necessary to include them all?
Well, we should start by saying Amir was part of this research team and a very big part. So I think in our instance, and we started with identifying stakeholders being, we were thinking about the needs of leadership in understanding all this work. So as Gary said, we had to seek permission from Tanya and Sheila to be able to do this work and then understand from their perspective what needs to happen and how. I think the stakeholders, if you think about the potential stakeholders in something this big, you're not touching them all. There are so many stakeholders at various levels of the system, all the way down to the public. So I think when we were thinking about producing information, we had an audience in mind. We knew who that information was meant to serve. And that's where we focused. And so I don't think it's necessary to include, it's to identify who our stakeholders are for these pieces of information.
Yeah, and I as before we got started doing this, I looked at a couple examples of developmental evaluations that were done out of the UK that were significantly more substantive than what we did. They were more substantive, but they came with a lot more resource too. And we didn't, so I think the amount of resource that you have at your disposal dictates the size and scope of the evaluation that you can do. And given the size of the team we had, which was pretty small, and the capacity and competence, I think, of the SHA team that was working, we were able to do something I think that was helpful. I'm pretty sure it was, without addressing, like Patrick said, all of the potential stakeholders in this case, which would have included all of the layers deeper down in the system. But they seem to be doing a pretty darn good job. So I was a little bit concerned as we got going that we maybe would be overwhelmed very quickly. But the very fact that the majority of the SHA vaccine rollout team had things under control made it possible for us to do the piece that we did.
Great, thank you. Okay, while I give folks a chance, we do have some more time. So while I give folks a chance to think of any other questions, one that's on my mind, I'm going back to kind of the beginning of the presentation where you outlined, usually we think about programs in a very straightforward, linear, step-by-step kind of way. And then when you get into it, in reality, it can go in many different directions. And there are outcomes and outputs that might be totally unexpected. So when you're in a situation like that and you're trying to evaluate, often the question we want to answer is, what worked, what didn't, what caused what? How do you tease things like that out when, maybe the path isn't quite as clear as you thought it would be in the beginning? How do you tease out that cause and effect relationship, or is it even possible?
I think I can tell you what we did, and whether that's the right approach or not, I'm open for conversations. But we would have our own conversations amongst our group from the people that were embedded to see what they were seeing, and then we would take that back to Tanya and Sheila, and say, this is what we're seeing, this is what we would suggest. And there was even a couple of times they said, well, no, that's not quite right. This is what was going on. And we would modify our report to them so that it would be correct. So it was actually a back and forth. There was never, like often with evaluations, the people that are being evaluated are sitting on pins and needles to see what the judgment is. There's no judgment in this. It was a back and forth, to and fro around how can we help you. And I think that attitude or that perspective is what made the difference. And so we would say, this is what we're seeing. What do you think? And they would point out things that they were seeing. And together we did this.
Really, here's that mindset of continuous learning and improvement in this kind of approach. It's not, ask a question, get an answer. It's continuously improve as you go.
Yeah.
Oh, go ahead, Patrick. Sorry.
Sorry. It does, and that's where maybe I saw the connection to quality improvement. In this work, it's a process of gathering data, interpreting it, framing issues, surfacing issues, testing ideas. It really supports that creative process and that Pdsa cycle. And I think maybe that's why it. I like the approach just because it aligns with the quality improvement philosophy and the Pdsa approach. So there's cause and effect isn't always clear right at the beginning.
Right. Thank you. So that has given us time to get another question through the chat. So I'll read this one. Do you have any suggestions about how to engage staff who are doing the work at the department or program level in the process of the evaluation?
So in our instance, and Gary mentioned it, we were trying hard not to be in the way of the vaccination rollout teams. But parts of our team were sitting in with team huddles and report outs on those vaccination things. So I think, although there was no, it's not like you would do a focused interview or something like that, but there was listening, and their voice was that data that we then later summarized into a report, right? Is we would listen, hear, observe, and bring their voice in there. So, you know, they were engaged to a degree, I suppose is how I would view it. But Gary, I'd welcome.
Yeah, I'm going to look at this from a little different lens, not from what we did, but what we could have done. And this comes mostly from the vaccine hesitancy survey we did. So like I said, we did a 1 week, we left the survey only open for a week. Jason Vanstone from the clinical excellence portfolio designed the questionnaire in REDCap, and we had a 1 week questionnaire that went out. It was open for a week, went out to the staff who had done vaccinations in the past 3 months and asking them the questions that we asked. I must admit, I mean, I've been involved with surveys of one sort or another in healthcare for a while. The uptake is usually about 20%. It was over 50% of the staff that responded to that. The staff that were the frontline staff are incredibly engaged. And had we had the resources, if I were going to design this again, I probably would have done a similar thing with staff and said, we're here to get your feedback and work with you as you do your on the ground QI changing and whatnot, and had similar kind of interactions with them. We didn't have the resources for that, but I think had we done that, we probably could have been added some support for the frontline staff as well, because they were very engaged, and I think almost for sure they would have stepped up to that and found that useful. We didn't, but I think we could have, and it probably would have added value.
Thank you. So I think we have time for a couple more questions, and there's, I think, 2 here showing up in the Q&A, so we'll get to those. One question here asks, is there a plan to share the learnings from those reports that were generated more broadly?
We are looking to publish this report, this method, because it's a relatively new way of evaluating, so it will get written up and hopefully be published somewhere. The reports as they stood were given to Tanya and Sheila and were intended for their development. So unless they wish to share them, I don't think that that we'd have to have their consent before we could do that.
Sounds good. Thank you. So one final question, and this is about how the team would define and manage the boundaries of the evaluation. So I think you talked a little bit about how the purpose was to serve the leaders of the initiative and provide them with helpful information. So how does a team thinking about a developmental evaluation go about defining and setting those boundaries? And then the second part of the question was, do those boundaries stay static, or do they change throughout a project?
I'll take first crack at that one, Patrick.
So I think we started quite broadly, right, to provide the support to the vaccination leads and to support. We're thinking about the geographical differences in Saskatchewan and how things are going to look different in the north, from the south, from rural, from urban, et cetera, et cetera. And we're hoping to learn, because there may be an innovation happening in one part of the province that's, worthwhile to spread to others. As we kept meeting with Tanya and Sheila, so we did that work, right? That was the initial boundaries, was to kind of summarize what's happening and share the learnings feed the learnings back. So that continued throughout. But in our weekly or bi-weekly debriefs with Sheila and Tanya, sometimes specific questions would emerge. What are you noticing about X or Y? And in those instances, then we have a need from a leader to understand a specific aspect of what's happening. whatever that might be, and then we would, kind of pivot to include their needs. Again, it's almost a fallacy. It's called an evaluation, but it's I guess it's developmental. It's learning. It's understanding the complexity, and they could pick out areas where they were struggling, or where there was more complexity, and ask us, are you noticing anything in these spaces? And then we would shift our boundaries or our scope to cover off those things.
And I'll just say that whoever asked this question, thank you very much. Defining and managing those boundaries was keeping me awake at night when I first offered to do this, because it was kind of like, this is a massive project. Like, how am I going to be able, because we were a smallish team of people doing this work. And I was quite anxious about that, to be honest. And if it wasn't for, once we got started, it wasn't until we got started that I think we were able to start to see, oh, okay, these people really have their stuff together for the most part. They were doing Pdsa cycles. They had weekly or daily meetings of the group of them that were overseeing the work. They were sharing those kind of ideas of what's working in one jurisdiction and not in another, of the issues that were arising. When vaccine hesitancy started to arise, they were already talking about doing pop-up clinics and doing other things. These all came right from the ground. So the very fact that there was good work happening, and we could see that and just say, we don't need to go there. We don't need to stick our noses where it's not necessary. And that allowed us then to step back and focus our boundaries and evaluation more at that higher level. And I think that saved us a lot of sleepless nights, but also let us focus on something that wasn't already being done. So avoided that duplication. So we definitely managed our boundaries over time. Going into it, it was a little bit scary, to be honest.
Thanks so much for sharing. So I want to offer my sincere thanks to Dr. Gary Groot and to Patrick Fallisen for your very informative presentation, as well as wonderful answers to the questions, and thank all the participants for your engagement in asking all those questions. I think we've learned a lot and had a really great discussion. And both Dr. Groot and Patrick have graciously offered to chat with anyone who's interested in further discussion following the session. So if you didn't get a chance to ask your question, please feel free to reach out, and they have provided their contact information on the screen. And so in addition to my sincere thanks, you will both receive a pair of these snazzy I Love QI socks. And so these are a highly coveted speaker gift for QI Power Hour. If any of you listening today would like to get your hands on a pair of these wonderful socks, we invite you to submit your interest in becoming a QI Power Hour speaker. We're always looking for new topics and new speakers to feature in our session. Or if you have a topic that you think your community of learners might be interested in, we'd love to hear from you. And you can visit the link being shared out in the chat to do that. In the spirit of continuous improvement, we are also interested in how we can continue to make this QI Power Hour webinar the best it can be and of most value to you. When you leave the webinar, you will be directed to an external site to complete a survey. It's not spam. Please don't be afraid to click that link and provide us with your feedback on what we can do better next time. Just to give you a sense of what's coming up next, as I shared earlier in the presentation, we are continuously getting new folks, new faces, new organizations joining us for QI Power Hour. So our next session is geared at those folks or those who've been around for a while and simply want a refresher. We're going back to the basics to talk about the model for improvement, and our very own Carla Flogan and Glenda Beauchamp will be here to present that. You can register. There will be a link shared in the chat, or you can visit HQC's website to do that as well. And one final comment in closing that I think is very fitting given our topic today is the writing on the sign behind me is probably too small for you to read, but just a reminder, if you haven't already, to protect yourself and protect your community by getting vaccinated for COVID-19. And please encourage, your friends and family members to do so as well, to take care of all of us in our province. And with that, I wish you a good day. I thank our speakers and I thank you for joining us today, and we look forward to seeing you next time.